You're welcome.
All righty, are we ready to begin?
Yes.
Please move this window away from the shared application. Not sure. Anyway, I'm John Altus. I'm a member of Hewlett-East Rockaway Jewish Center for over 25 years. My two children have been B'nai Mitzvah at Hewlett-East Rockaway. My dad was a member, and it's a place that I think is a wonderful, place where it has a real sense of community. And my talk today is about an intensive perspective of COVID-19. And this really is a sense of community. This talk is going to be hard for some of us, especially me. At the same time, it's going to, I think, bring us to a point of community that's really is what makes us, very special in terms of our ability to help each other. I thought it was somewhat ironic that today, as we now have this snowstorm, and as it's a snow day for many people, myself and my colleagues, we don't have snow days. No matter what it is, whether it's 3 feet of snow, whether it's a pandemic, we get up, we find a way to get there. And that's something that particularly, privileged and pleasured that I'm able to go ahead and be that, that person that can go ahead and hopefully rise to the occasion when I'm asked to. So March 13, 2020 is maybe a date that may not be all that significant to many people, but up until that time, we were kind of hearing stuff about the, about what's going on in China and about this, new virus that was coming in, and we were sort of being prepared for it. We had some grand rounds where in our hospital, the chair of medicine gave talks to us about it. We were practicing our PPE, equipment, and we were starting to have patients in the hospital that we suspected they were having COVID, but at the time we weren't really able to put our finger on it to prove it. We had heard at Northwell in their hospitals there was a lot of patients with COVID, and we were sort of like waiting, and that was the time where we started to kind of recognize that we're on deck. And on March 13th, 2020, that's when we had our confirmed case. And I remember that day because I was actually going down to one of our critical care units to wish one of the unit clerks retirement. She'd been there for, I think, over 30 years, and there's going to be a little breakfast. And so I come down in my usual, cheery way, and lo and behold, I see the staff that's huddled in the, in one of the empty rooms. I see it was the chief nursing officer, the chief of the critical care, all the heads of state, and the nurses were around and listening, and it really was in hushed tones. So it was kind of, I felt at that time I should really not open up my big yap and maybe listen for once in my life. And basically what they were being told was that this was our first confirmed case, and that some of the nurses were going to have to now, if they were exposed, they were going to have to, be quarantined, and they now were going to have staffing issues. And all of a sudden we were now, we were in a point now where we're at the beginning, this pandemic was now, welcome to Mount Sinai South Nassau, which is, where I was, where I've been working. So part of what had kind of happened as we started to have patients, I was looking to take care of my first patient, who was a 55-year-old healthcare professional, respiratory failure, and basically someone who was sick, presumed COVID infection, and they were in the critical care unit. And in the critical care unit, we take care of sick patients all the time. And this was something a little bit new. We weren't able to go ahead and get, weren't able to test and get answers right away. And this is a slide that Dr. Glad, who's our chair of medicine, I borrowed this slide, and it's meant to be chaotic, because all this slide is basically saying is all the different things that we were trying to do to be able to get the diagnosis. And so what our problem was is that we were not having the answers, right away. And so what was now happening was we were sending specimens. The testing was initially poor, and we were kind of like doing everything we can to get answers. So what was going on with that patient started to have respiratory failure. He then developed renal failure. He then went into shock. He was going to multi-system organs failures. And, we now looking to go ahead and deal with someone that we really had very little modalities on how we can go ahead and treat this, treat this patient. So I'm very fortunate in that, I work with, teams, one of our units that I'm able to, work with, and the nurses, we have a very good rapport. And so they kind of took a picture of me and they kind of, dressed it up, and they went ahead and had this, don't panic, because that is really one of my mottos, is that you just can't panic. You just can't let people, whether it's patients or families or their staff, you just can't panic. But now what was happening, we were now having a patient that we were, now getting more patients who were sick with respiratory failure, multi-system organ failure. We were treating them with hydroxychloroquine, Zithromax, all the things early on that we know now will probably, not be able to work. We were able to get that patient we were able to get remdesivir early on, but that patient didn't qualify because he was in renal failure. And so we were kind of really struggling. How do we go ahead and cure and attack this virus? So what happened then, we now have to go ahead and gear up, and we now needed to be able to wear our PPE equipment. And if you can see on this slide, I kind of starting to wear my wear my N95 mask, wear my shield, wear my gown, and if you kind of like little notices, I still have that sport jacket like underneath, because that's that was something at the beginning. I was just kind of okay. We were kind of going around and trying to do all our PPE equipment and wear stuff, but this was now, my get up for the moment. So the next, what was happening then, I then had, I was still on ER calls. And so basically new patients would be coming in. And so on these ER calls, all of a sudden we'd be getting a ton of patients with COVID. And so what would happen is that we'd have to go ahead and create new critical care units because we had so many patients. We had to make separate COVID units. And as time was going on, we were concerned that we may not have enough. What this is a ventilator. This is the screen of the ventilator. It's connected to the bottom, and you can go ahead and see the excuse me. I have a very heavy finger, and with this ventilator is something that I cherished, because we were worried that we were going to go ahead and run out. And the hospital, they did a tremendous job. They went ahead and anywhere they could, they went to go ahead and get ventilators. They went ahead and, we're part of the Mount Sinai system. We went ahead and anywhere that we could get ventilators, the hospital did. What was sort of interesting is that our leaders in Washington were telling us that we had enough ventilators, we had enough PPE equipment, and we didn't. And we then were looking to go ahead and use our anesthesia ventilators. When someone has surgery, they would go ahead and They go to the OR, they would use those ventilators, and we thought we could use those ventilators, and we tried to. And unfortunately, those 15 ventilators that we thought we had in the bank, they failed. So now we're gearing up now. We now start, normally we have around 20 patients on ventilators. We're now gearing up to have over 100. And we're now going to see, do we need to go ahead and share ventilators? Do we need to go ahead and triage ventilators? Do we need to go ahead and say, okay, who should get it? Who should get a ventilator and who not? And that is, a very, very disturbing, issue that was, going on. I have this thing that's seeing on my screen that says, please move this window away from the shared application. Anyone know how I can get rid of that? Offhand? No, see, every time I click and it pops up. Anyone know how to get rid of that? Move this shared? Anyone awake? Any experts here? I guess not.
It eventually fades off.
How do I get rid of it?
I don't know how you get rid of it, but it eventually fades off.
Try clicking on it and sliding it to the right.
Yeah, try.
No. Okay. All right. Anyway, so pardon me for the technical difficulty. So we're now going through. We're now making decisions about. We're prepared to make decisions about ventilators. We now have over 100 ventilators. We want more, and I now start to have patients that are, coming into the hospital, and we now have, patients that I'm assigned to because it's my night on call. And one of the patients, as you can read up here, is a 75-year-old male with hypertension, COPD, who's an office patient of mine. So he walks into the emergency room, and he has trouble breathing, and he sees me, I see him, and I talk to him, and he's pretty sick, and we made him to the hospital, and then the next day he develops worsening breathing, where we have to put a tube in to breathe for him and have a machine, going ahead and keep him alive. And so, I know his family. So I remember speaking to his wife and, telling her about, that he needs to come to the hospital, he needs to come and stay in the hospital, and that we're going to do the best we can to take care of him. And, she goes, Dr. Altus, I trust you. And so we go ahead and, he's now, on a respirator, he's sent to the ICU. And what had happened now is that I now was in charge of one of our 6 ICUs. So I had 15 to 20 patients that were all as sick as one could be in the hospital. They were all on respirators. They had renal failure. They were in shock. Some had strokes, and on and on and on. And so now we're in a point where the unit now was a critical care COVID unit. And now all of a sudden I now have a new getup. I now am, wearing my scrubs that every day I had to go ahead and change. I wear my N95 mask, and you can see the people behind me. So I'm now wearing scrubs every day, and every day I bring in new scrubs to get cleaned, and I get a new pair of scrubs. And so now we're in this, unit where it's all COVID all the time. We are still, trying to conserve our PPE. There was enough around, but we would put our PPE in plastic bags, and we would, go ahead and, we would preserve what we could, and then we would use what we can. So this patient then, the family couldn't go visit their loved one. This is office patient of mine. And he went into renal failure. He went into shock. He developed collapsed lungs, which we need to put chest tubes in. And he got, worse and worse, where I had some difficult discussions to the family, and they were, considering doing withdrawal life support, which they did not. So we, went ahead and took care of him as best as we can. And then a couple of days later, they were calling me up to say they've come to a decision. And just at that moment, he had passed. And so this is someone who was an office patient who the family now, not only could they not visit him, but now after we had deaths, we did allow families to come in for just, that moment. But, they elected not to because they were worried about their own health. So we were very sensitive to that, and we were very, cognizant about what a horrible, terrible circumstance this is. And, and every day I would come home, I would, go ahead, my lovely daughter and my wife, I would give them my daughter would interview me, and that probably was therapeutic for me as I was telling them the day, what was going on. As my wife went up to the, the third floor to stay away from me as much as possible. She made my meals. And then as I would go ahead and just go over the details of the day, I could see their horrified look as to like, what is going on and what are they going to do to my little Johnny over here in this COVID unit. So whenever we had a patient that died, as the family was not able to go ahead and visit them, what we would do is that we would gather the staff around to go ahead and, talk a few moments about how this person was a human being. They weren't the person in room 2A. They had a family. They had possibly a wife or children or grandchildren. And that even though their family, wasn't there, they were part of our ICU family. And I will tell you that, unfortunately, I had to do this many, many times. And every time I would go ahead and, get the staff to come around, they would quickly, when there wasn't patient care at risk, they would quickly come around, and I would go ahead and say a few words and talk about how this was a human being and that he died with his ICU family, and it was unfortunate that his family couldn't be there. But we were there for him. And so this was a picture that one of my colleagues took, and we call this the pause. And you can kind of see is that we're all around the bed, and we're really kind of like, we're standing still. We're not running around doing stuff because this patient had passed. And, we basically, wanted to humanize every patient that was there. We went ahead and, looked to give them their much respect, and that even though their family wasn't there, they died with loved ones who was able to go ahead and, speak of him as a human being, and that while this pandemic was devastating everybody, we were still, acting, as their family and looking to, give them the due respects that they would if their family was there. So I have a few more patients, and, this was a 42-year-old male who was in good shape. We heard of always these patients that are, that are overweight and have hypertension and heart disease. This guy was in good shape. He had no illness. He went into respiratory distress, and he needed to be placed on a ventilator. Oh, and by the way, his wife was 9 months pregnant. I had another patient who was a obese woman with pneumonia. She went to cardiac arrest, and she was then transferred to our critical care unit. Another patient with pneumonia, respiratory failure, another story, transferred to our ICU. So now what was happening is that we were having, a lot of patients like this, that they had respiratory failure, and most of them developed renal failure, some liver failure, some strokes, and they were developing collapsed lungs. And so what was happening is that this really was a true, mass casualty. This was just so many patients to take care of. I had my 20 patients, and, so I literally was there, anywhere from 14 to 16 hours early on to maybe a little less, 12, 13 hours when things straightened out. And then I'd be wearing this N95 mask for so many hours, except when I was able to go ahead and eat. And, this is now what I saw it to look like. And hopefully you can kind of see a little bit of the Band-Aid of, that's, across my nose, and you can see the marks from that N95 mask. And you can see in my pocket the list of those patients and the stuff I need to take care of. I'm big on putting sheets in my pocket. Normally I put it at the inside of my coat. And that's what the days looked like. Unfortunately, by the next day is that, my face reverted back to its normal pretty self, with just my normal aging lines and not the lines from the mask. So we were doing this day in and day out. And then finally, we were really all hands on deck I was able to, eventually get a day off. And this was a, picture my wonderful daughter took, and she says on the 23rd day, he rested, and this was a time just to be able to just, walk my dog, be with my family, get a little bit of a breath, and try to go ahead and refresh. So then I went back to work the next day, and so what was happening in our units, nurses were really working, around the clock. They were, they were normally nurses will have 2 critical care patients. Sometimes they had 4, sometimes 6, sometimes 8. We were getting deliveries from all around, local places, people sending in donations. They were sending in food. They were sending in all sorts of, pastries, which was very well received and very well, appreciated. And, I'll tell you that, I was able to kind of get off the floor to kind of, move around. Sometimes I needed to go to the to go to the ER to see someone. And so one of the things I did is that I was a little bit of a cheerleader. And part of me being a cheerleader was, trying to share a little, good things with the staff. And so when there was when there was ice cream, pops downstairs, I went downstairs to go ahead and bring the strawberry shortcakes up. I would go ahead and bring water up to the staff because they couldn't leave the bedside of the patients. I would do everything that I could because this was a team effort. This was something where, everybody was doing everything they could, to go ahead and every ounce of energy that was being put in to try to help our patients and to try to give them the best possible care. So even though I kind of bring, the ice cream up, for many of you who know me, I never miss a ice cream bar. So if there's ice cream around, I'm going to have at least mine. And, and so I only took one that day. I, saved some for the following days in the freezer. But this you can kind of see as a moment of relief where, we kind of look forward to the meals a little bit. And, we're able to just enjoy a moment of ice cream, which, is one of my favorite foods. This next slide is that I'm wearing a different mask. And the significance of this mask is that when we were in the, intensive care unit, we had staff that came from all over the, all over the country. And one of the nurses was actually from Utah. So what she went ahead and did, she had her family and her friends make masks for us because there was a concern there was a shortage of masks. So they went ahead and had masks. They shipped it to us. And so this is one of the masks that they went ahead and sent to us that, I went ahead and took. The Dr. Altus, that was made, one of my colleagues went ahead and ordered that for me because, maybe my gray hair was scaring people or she thought maybe I needed to be protected from possible COVID from my head. So on this next slide is that this is, this is a shot of one of the groups of people that that helped us, and that we had, doctors from Arizona, who's an anesthesiologist, and he was someone that, they stopped doing elective procedures, so they had sort of furloughed him. So they was able to go ahead and he was looking for work, so he came out to help us. We had nurses from around the country. We also had our own staff, PAs and NPs, that were doing other work normally. They'd be in their surgical unit. They'd be outpatient doing bariatric surgery. They'd be at different areas where, they weren't really, able to take care of critical care patients, but they were, but they did have credentials and they knew how to go ahead and, take care of patients. And part of my role was to go ahead and train them on the fly to get them what they could do to help going ahead and take care of these, patients. And so what would happen is that we would do rounds every day, and I would lead the rounds and I would divide up the work and, assign each of them to patients that they would report back to me. And this way we were able to kind of take care of these 20, very, very sick patients that were really a Herculean task. So we got organized about how we go ahead and take care of these patients. And they did a fantastic job. It enabled me to be able to go to the bedside because constantly there were these fire drills. All of a sudden, someone couldn't breathe. Their oxygen level was low. Their blood pressure was low. So they would call me over and they would be looking at me like, what do we do now? And so we would look to go through the troubleshoot. We'd use, part of the staff that was with us, and we'd figure out what was the problem and fix it. And so this enabled me to go to, bed to bed and take care of, all these fire drills that were, that were going on. So I went ahead and I told you about some of these patients, and I want to give you a little follow-up. So this patient that I mentioned before, he was the one whose wife was 9 months pregnant. So what we were doing in the critical care units for patients who had low oxygen, we were proning them, which means is that we were flipping them on their belly to go ahead and try to improve their oxygenation. We also would temporarily paralyze them with paralyzing agents that were reversible. And so this was somebody who had been paralyzed and prone, and then on one of our routine times after we proned him, one of our healthcare workers from Arizona did as proper following up and went ahead and checked one of the blood gases, and lo and behold, the blood gas is totally out of whack. And basically, it was something where his carbon dioxide is very, very high, his pH was low, and if we didn't intervene, this guy would have been dead in a matter of short few minutes. We go ahead, we flip him on his back. We go ahead and try to troubleshoot to see what the problem is, and we see that the tube had been kinked when he was on his belly. We go ahead, we fix the tube that's connected to his mouth into his lungs. We go ahead and we get his blood gas back, and now he's better. He was someone that was in kidney failure, respiratory failure, in shock, and he was someone that we were able to get off the respirator. We were able to go ahead and his kidney, after dialysis, his kidneys improved. He no longer needed dialysis, and he got better, and he actually got discharged from the hospital. One of our other patients, so this was another young woman who had multiple medical problems. She went into respiratory failure. She was on a respirator, had a cardiac arrest, probably had strokes, on and on and on. And she was someone that we were able to go ahead and eventually wean her off the respirator. She had a tracheostomy and a feeding tube. Her kidneys got better, her lungs got better, but so far, her brain has not gotten better. So she's not, unfortunately, has not woken up, and she's been in a facility trying to get rehab. I'll tell you, though, that in the hospitals, part of what we would do whenever we had a patient that we were able to get off the respirator, over the loudspeaker, there would be a song called Breathe that we would go ahead and, that would be played over the loudspeakers. And that was something that really got us all, really fired up. That like, we got another patient off the respirator. When we had a patient that got discharged, we'd have another song that would go ahead and say, "Here comes the sun," just to, go ahead and just share that give us that strength to keep on going. There's light at the end of the tunnel. On the other patient that so this was another patient that went into respiratory failure, was on a respirator, went into cardiac arrest. This patient, we were resuscitating him the whole day. We could do with our medications, with CPR. And then it came a point during the day that we, his heart wasn't coming back. And it was after a long time. And it was kind of said, unfortunately, this patient has passed. So we stopped. And then lo and behold, one of the nurses goes ahead and says, I think I feel a faint pulse that we didn't hear with the initial Doppler, which is one of our instruments we used to hear these pulses. So I said, okay, we gear it back up. We start with our medications. We go ahead and, do CPR again. We go ahead, get his blood pressure up, and we go ahead and resuscitate him, and he's now alive. So he eventually was transferred to one of the other critical care units that I didn't take care of. He eventually had a tracheostomy, which is a tube that goes into the neck as opposed to the mouth for patients who are going to need longer support. And he eventually came back to one of the other units I run, Respiratory Care Unit, and we were weaning him off on the respirator, and lo and behold, the guy woke up. The guy woke up. He was able to, communicate with us, and he no longer needed the respirator. So what we were going to go ahead and do, we then sent him to rehab. So we weren't allowing visitors at all, and the nursing homes weren't allowed visitors. But on the handoff from the hospital to the ambulance, they did allow handoffs in the parking lot. So this family was able to go ahead and see their loved one being transferred from the hospital to the nursing home. And this is the picture that they took, and it's here in my office. You guys can see it. And
Yep.
This kind of this inspires me as to, just keep on going and forge ahead. And in the car was actually this patient's mother, who was still around to see. So he got better. He now was able to communicate and talk and eat. So that was a success. The family went ahead and sent us, this big thing that just a thank you. That was, much appreciative. But this was, clearly, one of our successes, along with, unfortunately, many patients that, that had passed. So now, as we're sort of going ahead and moving forward, what's happening now? Well, I can tell you in the hospital, we are starting to have an overwhelming number of patients again. Our critical cares are expanding. Right now, though, it's probably not all COVID patients. But what we're focused on is looking to go ahead and do prevention. So this is another slide that Dr. Glad, who gave me a bunch of his slides about what happened in the, flu precautions in 1930s and don't kiss your kids and whatever. And, fortunately now we have vaccines. And while I was not able to hear Dr. Fauci and talk today, I can just tell you that the vaccines are lifesavers. It's light at the end of the tunnel for us. And I know there's a lot of concern about what's in the vaccine. Is it safe? Is it, those are very, very legitimate things where people are very, very interested in making sure that the vaccines, that they are pure and perfect, because we know that everybody here is always making sure that no matter what goes in their system, they've investigated every ingredient possible. Just like when we eat a hot dog, we all know all the stuff that's in the hot dogs that we eat. I know a pig in the blanket or at a bar mitzvah or a hot dog on the grill, nothing better than that. But what's so interesting is that we demand this scrutiny, which I'm fine with, about getting the vaccines, but there's so many things we ingest in our bodies that we're not all that interested in or care. So at the end of the day, people ask, are the vaccines safe? What are the side effects? Or the efficacy? Is there diversity? So the answer is basically yes, 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 yes. What that means is that the vaccines have been safe, they're effective. There are more vaccines coming out, which is fantastic. I would say that in terms of which vaccine, I would say whichever one's available that you're able to get. People do have side effects, so you should be prepared to have those flu-like symptoms where you want, especially if you're highly allergic, you can develop chills and sweats and fevers and things that could be very, very disabling. But at the same time, it's important to put the whole thing in perspective. The data they did with the vaccines, and I'm talking about really for the Moderna and Pfizer vaccine, I don't have any information on the newer ones from Johnson & Johnson or AstraZeneca. They really haven't been presented to the FDA, so that I'm not aware of what the data shows. But I would tell you that it's worth it. You may feel terrible. You may have bad side effects. If you're highly allergic, have it done in a hospital. Have the appropriate healthcare people take care of you. But it's crucial to go ahead and get your vaccine. This is the only way out. You want to start having services at the temple and people saying, I'll pass. If everybody passed from having taken their vaccine, we'll not be able to get the immunity for everybody. And you won't have services. You won't have bar mitzvahs. You won't have weddings. You won't have ball games. You won't have theater. You'll just be sitting in your house and enjoying time with your lovely family. So I would urge everyone to go ahead and go the vaccine. And I have the picture of one in there, so somehow I lost it in here, but so everyone should go ahead and take their vaccine. Oh, here it is. Excuse me. So I got my vaccine. I was fortunate enough to get both shots, and it didn't bother me. I felt better after getting the vaccine. I was as happy as could be, because this to me said there is light at the end of the tunnel. And I hope everyone goes ahead and gets that. Get their vaccine. This is the way we can get out of this mess. I want to just tell you, this is the sign that I see when I leave the hospital every day to the healthcare workers fighting for our lives. Thank you. I can tell you that I was so privileged to be able to work with so many of my colleagues. We would lift everybody up. I remember telling them all the time when it seemed like they were getting down, I would go ahead and tell them that, you guys and gals are my heroes, whether it was the nurses, the therapists, the food workers, the doctors, administrators. I go, if it wasn't for you people taking care of these patients, no one would. And you guys are my heroes. And I just want to, wanted to thank them all for what they've sort of done. Made me just so proud to be part of this, this team to go ahead and we appreciate what the community, had done, going ahead and, the cheering and sending food. And, we had firefighters locally that would cheer us. That, it was really just, a wonderful feeling. And, I can tell you from the bottom of my heart, in my career, I was around during the AIDS epidemic, which was horrible and terrible. This was so much worse than that. And that it was communities like our communities that basically went ahead and rose to the occasion, trying to go ahead and get the PPE and all the ventilators and the staff, where unfortunately the federal government was remiss. And how when our local nursing homes, which everybody wants to kill the governor over, the governor saved us, because we didn't have room for those patients from the nursing home to go ahead and say, you have COVID, go to the hospital. We didn't have that. We were trying to send our patients from the hospital to the nursing home. And maybe some of the nursing homes, they didn't do a great job in infection control like we maybe did at our facility. But it was our local governments that were really thankful, and the people doing, this Herculean task. And, I want to thank, all of them and thank them for, being part of the team, and all my coworkers. It was very uplifting to hear, hearing from coworkers asking how this patient do, how that one do, and thanking me of us working together. So this has been like an unbelievable experience that I hope I never have to again in my, in my life. I tried to go ahead in this talk, give you a little insight as to what it was like being a, COVID intensivist, in terms of both, unfortunately, the sad stories, but also of some of the positive ones about, as a community, how we came together to help fight this, this horrible virus. And I'm hopeful everybody will go ahead and take the vaccine, so we can all get on to enjoying our happy simchas. That will that's what we love to share and live about. So I'm happy to take any questions, comments, thoughts, ideas, and I'll if someone can go ahead and tell me who wants to talk, or just go ahead and talk. I'll I don't think we have a host, so anyone who wants to ask a question, feel free.
Don't take the sharing off so you can see everybody.
All righty.
Artie, if you want to talk, please unmute yourself and then ask your question.
So, Dr. Altus, I'm just going to take the privilege of being the rabbi here and say what is on everybody's mind. Thank you for this talk, and thank you for all the work that you have done. And I would assume continue to do. As you told some of the stories, I started thinking of the phrase in the Shemona Esrei of Mechayeh HaMeitim, of reviving the dead. And there's all kinds of theological, implications about that, and questions which we can discuss. But some of the stories you told really made me think of really reviving the dead. And one of the stories you told about the nurse who just felt a small pulse, it sounded like the patient was as close to death as possible. So that's really an amazing story. And I think your message that you shared with us, and we're a large group for Lunch and Learn. We're not a large group in the synagogue. We will figure out a way to share this message with the entire HERJC community, and certainly encourage anyone who is ambivalent about getting the vaccine. I think after hearing you would not be ambivalent about it, and hopefully we'll get the vaccine. And finally, I just wanted to ask you, do you think it's going to get really bad again because of these new kind of viruses that are coming in? Or do you think we're okay because we're slowly vaccinating people?
I think we're going to get better. I think we as a society, we have this, we think of it as a light switch. We're either all going to die or all going to live. And what's happening now, these vaccines, they really are, this is really, the result of science and pharma and big pharmaceuticals that get bashed all the time. They came to the rescue. They got on their white horses in less than a year. They came up with this, vaccine and vaccines. I mentioned I was a physician. I was a resident during the AIDS epidemic starting then. We still don't have a vaccine for HIV disease. And it's a different virus, of course, but the fact that we're able to get this vaccine means that vaccines, we're at the beginning of putting this under control. So what's happening now is that we always expect variants of these viruses. We're not going to get 100%, immunity for everybody. But once everybody starts taking these vaccines, it's going to start to put an end to this. Because just like the flu vaccine, just like the flu every year, we have to take a different flu vaccine every year, is that we don't know what will happen. We don't know if the virus will morph enough that, yes, every year we got to take a new vaccine. We don't know. But we know right now the vaccine is very, very effective. And that if we take the vaccine, this is going to now start to put an end to this pandemic. So even though we have this variant, even though we have the South African, we have the New Jersey variant and, the whatever, this is the beginning of the end if everybody gets vaccines. So it's another way we have to be we have to be on top of this and being ready for this. It's something where I expect we see a light at the end of the tunnel. I'm expecting the peak to have finished, and now we're going to start to get better and better and better.
Thank you.
I don't have a question, but I just wanted to say, before COVID, I was a volunteer at South Nassau, and very often I would walk into the ICU and I'd see Dr. Altus either working with patients or working with a group that he was training. I just think he's a fantastic guy, probably a fantastic doctor, but I've never had him, as a doctor. And I thank you very much for the talk, Jonathan. I thought it was great.
Well, I thank you for the shill. I appreciate that. But also, you go ahead and you volunteering, at the hospital, as I've seen you do before COVID. That's inspiring. You're going ahead and you're taking your time. I think that's inspiring. It's a lesson to all. I also like to add, just part of my Jewish background is that when I had that office patient of mine died, I know that they were, a Jewish family. And I asked the wife, do you want me to say Kaddish for him being there? And, and she said yes. And she was, thankful for that. So with any little bit of comfort we would try to give anyway. Sometimes it's listening, and, I'm just so humbled. I'm so lucky. And, to be part of a place where I work, that there's that community like you coming in to volunteer your time to go ahead and help any way you can. There isn't a job that you won't do. And that's something really, really applaud you about.
Thank you.
Any other questions?
Yeah, John, it's Harold. Were you and the whole healthcare team managed to stay healthy through all this?
So for the most part, yes. A couple of my colleagues, did get sick, and they were out a while. I would say the overwhelming, and there were also there were sporadic, nurses and some doctors that were out. So they had to be quarantined and they had to be out for a while, and then they would come back. So for the most part, we did pretty good, but there were people that were out. Not overwhelming.
I'd like to say something.
Yes, sir.
First of all, thank you very much for sharing your experience and your hard work. I want to thank you for this dedication. It's absolutely amazing. I'm reading the paper that the next challenge is really the immunization, because there are so many people, unfortunately, who object to it. Is there any education in the community to make sure that everyone is going for the injection?
So look, it's volunteer, so it's amazing. And you know what, I have to kind of comment when there were people in this country that made believe this was that this was a joke, that was kind of really very, very, disheartening. And that this was, to wear a mask became a political statement. It was the most ludicrous thing you can come up with. We're here fighting death. As I told my daughter and my wife, I sometimes filled out 4 death certificates in a day. And there were people with the chutzpah making it believe that this didn't exist, that it was it was oversold, it was make-believe. And all we're asking to do is to wear a mask, wash your hands. And it is disheartening to have that as a, as a response. So if everyone wants to go back to regular scheduled activities, get the vaccine when it's available to you. That's the bottom line.
My name is Fred Smith. I'm a friend of John's. I tuned in late, but he's really an amazing physician. And I don't know if you've seen the interview that his daughter Lauren, who I see is also here, did with John, but it's quite inspiring. It may make you cry, but I suggest another time to look at that video. It's really impressive.
I'll see if I can find a way to share that. It's so hard for me to figure out what the size of it, but we'll try to come up with a plan.
We'll figure out a plan that
Fred.
we can get it out to the congregation somehow with your okay.
With Lauren's okay. She's the owner of it. My daughter Lauren owns the
That's who I was
videos.
talking to, John.
Rabbi Fred Smith is a doctor too. Hello, Fred, it's Yosef. You're silent.
Yes. Hello, Yosef.
How you doing?
I think we both look a little older now.
Yes.
Yes, I'm doing okay, thank you.
Do you want to make a comment?
Sheltering in place. I have a ponytail now.
Oh, great.
Yeah.
This will be
I've had a
my
haircut
future.
almost a year. I think I have Samson's strength. I could pull down Mar-a-Lago, I think, if the Lord directed me.
Fred, do you want to make a comment on what is happening now? Fred, do you want to make a comment, your opinion about what is happening? I cannot hear you. Okay.
John, I might just add that with these newer vaccines, people may see that the efficacy rate appears to be lower than Pfizer and Moderna, which are supposed to be in the 90+% range, and the others in 70+% range. With that, you have to take into account that, for instance, in South Africa, they may have been dealing with a population who's already showing these variants that are more resistant. If Moderna and Pfizer were tested against that, they might not do much better. But the important thing about all the vaccines is that they seem to prevent death and perhaps reduce the number of serious hospitalizations. So people should be aware of that. And I agree with you. I think whatever vaccine somebody can get, they should.
If Dr. Fauci says it's okay, and with the FDA making it available, take it.
Yeah.
Any other questions? All right, Dr. Altus, I didn't have a chance to really give you a proper introduction, but let me thank you on behalf of the entire congregation and the community. Very eye-opening, very inspiring. We also are going to have future lunch and learn sessions, not quite as at the same level. Lisa Cohn is going to be speaking next week about good poems for hard times. Rabbi Warmflash is going to be speaking in 3 weeks. And Rabbi Schlesinger's wife, Juliana Portnoy, is going to be speaking in about a month. And finally, the last one I have scheduled, our Chazan is going to be speaking on March 8th for chanting and mindful meditation. So let me thank all of you for attending. And once more, let me thank Dr. Altus and Audrey Polinsky for introducing him to us. Thank you.
Thank you, Keith. Thank you, Keith, for your help in arranging me and getting things set up.
Thank you
John,
all.
greatly appreciated.
Thank you.
All righty.
Great job. Thank
Be
you.
safe out there, and especially when you're driving tonight.
Thanks so much.
Thank you so much. Wonderful talk.
All right.